is Paul. I'm one of the orthopaedic physios working at McGalvin Hospital. This is just a short video for some advice and exercises after your total knee replacement. The aim of these exercises after a total knee replacement is to regain range of motion, regain strength and improve the function of your knee. Pain is expected, so make sure that you have adequate pain relief post-op as per your doctor or your pharmacist, and make sure that you have regular ice 3 to 4 times a day, 10 to 15 minutes after discharge, using your ice sleeve or a bag of peas wrapped up in a towel. Firstly, I'll go through exercises that aim to straighten the knee. So lying down, if you want to have a towel under one leg, and we're pressing the back of the knee down into the towel, and you can hold this for about 5 seconds. Take a rest for a couple of seconds and repeat this 5 times. So you should feel a good squeeze and a tightening of these thigh muscles at the front. Something similar but a bit of a progression is if we put another towel under the knee, so it's a wee bit more of a height, and we're doing the same action but this time lifting the heel off the bed. Again, holding for 5 seconds and relaxing. And we can repeat this 5 times. Another exercise aimed to straighten the knee would be doing the same action as the previous exercises, where we're tightening the quad muscles, but this time lifting the leg up off the bed and pulling the toes up towards the face. So you're only lifting maybe about 10 or 11 inches, but aiming to hold this for about 10 seconds and relaxing. And we can repeat this again 5 times. Alright. Exercises to help straighten the knee that stretch these hamstring muscles, the muscles behind the leg, is just sitting over a chair, having your affected or operated leg out straight in front of you, keeping it straight with the heel on the ground and bringing the toes up towards your face and leaning over that knee. And you can use the other hand for a wee bit of assistance, a wee bit of overpressure just at the knee. Now you'll feel a wee bit of tightness just at the back of the leg, but that's normal. Alright. And when you're resting during the day, whether it be sitting on a chair or lying in bed, try to use a heel prop, something to hold the heel up, which will keep the knee straight as we're resting. This will put the knee into a more natural straight position and keep us out of that flex position, so it'll prevent the knee from getting stiff. As your wound heals, you may start to massage the area around the knee, just keeping an eye out for any redness or infection or increased oozing. You may want to start swimming as a good exercise after your operation. Again, just keep an eye out for any infection and make sure that your wound is nicely healed. 6 weeks after your operation, you can start some static bike exercises, but make sure that you start off with a higher seat and bring it down as your knee flexion improves. 6 weeks again after your operation, you may wish to return to driving. Make sure that you have sufficient knee flexion and movement to work pedals, and you're able to safely perform an emergency stop. Pain and swelling is normal several months after this operation, and it can take up to 1 year to realise the full benefits of it. Make sure that you maintain the movement and these exercises to realise the full potential and to get the best out of the operation. You should aim to complete those exercises 3 to 4 times a day on top of regular building. You should aim to get weight bearing as soon as possible after your surgery. After your surgery, a physiotherapist will be around to give you a set of elbow crutches and demonstrate their use. They'll tell you to try to normalise your gait as much as possible, getting a good heel strike down, straightening the knee as you roll off your toes, and bending your knee as you start to walk again. As this becomes easier, you may wish to go down to one crutch. Make sure that the single crutch is on the opposite side of your affected knee, the one that's been operated on, and you want to take a step and with the crutch at the same time, just so supporting that walk. Alright, As your function improves, you may wish to get back to independent mobility and do this as pain and function both allow. Next, we're going to go through exercises that aim to facilitate knee bend, and with this here we're aiming to get to at least 90 degrees where the knee's at a right angle. Alright. Again, these can be started off in lying and simply just dragging the heel up towards the backside, trying to bend the knee as best we can. So just heel slides along the bed. If this is difficult at the start, we can get a plastic bag or something with less friction beneath the heel and pull towards the backside again. We can do about 8 to 12 of these depending on how you're getting on. As these become easier and you get a wee bit more knee bend, we can use a towel under the forefoot just to encourage it into a wee bit more flexion as that becomes easier. Another exercise only in sitting. This time we can let the knee bend naturally, letting gravity pull it down to its normal position and using the other knee for a bit of encouragement. Alright, so using the other leg for some encouragement. If we get to a position where it's a little tight, we can hold this for 15 to 20 seconds, again repeating about 5 times throughout the day. Alright. Something that some patients find very useful is a set of pedals. These can be picked up relatively cheap online for about £15, and starting with the pedals further away from yourself and just pedaling, getting the range of movement at the knee and getting some more activity. As this becomes easier, we can bring the pedals closer to ourselves, so it's encouraging more knee bend. Alright, but it's good to get that activity at the knee and get that range of motion. If you have a step at home, we can practice the knee bend by stepping up onto the step and then just leaning forward. So we're encouraging that bend at the knee. And you can use something, a real handrail, just to hold yourself as you stretch into it. So lean into it again where you feel that wee bit of tightness at the front of the knee and holding for 15 to 20 seconds and repeating 5 times, and you can relax. As function improves and things become easier, we can start to use the step as a wee bit of strengthening. So stepping up onto your affected leg and back down. Stepping up onto your affected leg and back down as your function improves.